Question 1. A nurse is assessing a patient after a dilation and curettage D&C procedure. Which finding requires immediate intervention? A. Mild cramping. B. Saturating a perineal pad in 15 minutes. C. Pinkish vaginal discharge. D. Complaints of fatigue. Answer. B. Saturating a perineal pad in 15 minutes. Rationale. Excessive bleeding after a D&C is a sign of hemorrhage and requires immediate action. Mild cramping and light discharge are expected. Fatigue may be normal post-procedure, but heavy bleeding indicates a complication. Question 2. A nurse is teaching a patient scheduled for a hysteroscopy. Which patient statement indicates understanding? A. I'll need general anesthesia overnight. B. I may feel cramping after the procedure. C. I should avoid fluids the day before. D. I won't need any follow-up afterward. Answer. B. I may feel cramping after the procedure. Rationale. Cramping is a common side effect after a hysteroscopy. The procedure is typically outpatient and requires local or minimal sedation. Patients should follow up as needed. Question 3. Which gynecologic patient should the nurse assess first during morning rounds? A. A patient post-hysterectomy with a temperature of 99.1 degrees Fahrenheit. B. A patient post-laparoscopy complaining of shoulder pain. C. A patient post-myomectomy with foul-smelling discharge. D. A patient receiving for antibiotics for endometritis. Answer. C. A patient post-myomectomy with foul-smelling discharge. Rationale. Foul-smelling discharge is a sign of infection post-surgery and needs immediate assessment. The other findings are either expected or less urgent. Question 4. A nurse is caring for a patient who underwent a vaginal hysterectomy. Which action should the nurse perform first? A. Encourage ambulation. B. Monitor urinary output. C. Offer food and fluids. D. Educate about vaginal rest. Answer. B. Monitor urinary output. Rationale. Bladder injury is a risk after hysterectomy. Monitoring urinary output helps detect complications early. Other interventions can follow once the patient is stable. Question 5. A nurse reviews discharge teaching with a patient who had a loop electrosurgical excision procedure, LEEP. Which instruction is essential? A. Resume intercourse in 3 days. B. Heavy bleeding is normal. C. Report signs of infection immediately. D. You may take aspirin for pain. Answer. C. Report signs of infection immediately. Rationale. Infection is a risk after LEEP. Patients must report fever, odor, or discharge. Intercourse should be avoided for 3 to 4 weeks. Aspirin may increase bleeding risk. Question 6. A patient reports pelvic pain, fever, and purulent discharge. Which condition should the nurse suspect? A. Ovarian cyst. B. Pelvic inflammatory disease, PID. C. Endometriosis. D. Polycystic ovarian syndrome. Answer. B. Pelvic inflammatory disease, PID. Rationale. PID often presents with pain, fever, and purulent discharge. Other conditions may cause pain, but typically lack systemic infection signs. Question 7. A nurse prepares a patient for an ultrasound due to abnormal uterine bleeding. Which instruction is most appropriate? A. Empty your bladder before the test. B. Drink fluids and do not void before the test. C. Avoid caffeine before your scan. D. Expect sedation during the procedure. Answer. B. Drink fluids and do not void before the test. Rationale. A full bladder improves visualization of pelvic structures during a transabdominal ultrasound. Sedation is not used, and caffeine is not restricted. Question 8. A patient with uterine fibroids reports heavy bleeding and fatigue. Which lab value should the nurse review first? A. White blood cell count. B. Platelet count. C. Hemoglobin level. D. Glucose level. Answer: C. Hemoglobin level. Rationale: heavy bleeding can cause anemia. Hemoglobin levels should be evaluated to assess for blood loss. Question 9. A nurse is caring for a patient with an ectopic pregnancy. Which assessment finding requires immediate action? A. Cramping pain. B. Mild vaginal spotting. C. Shoulder pain and dizziness. D. Nausea and vomiting. Answer: C. Shoulder pain and dizziness. Rationale: these symptoms suggest internal bleeding due to a ruptured ectopic pregnancy, a life-threatening emergency. Question 10. A patient asks why she needs a pap smear. What is the best nurse response? A. It helps detect ovarian cancer early. B. It checks for signs of cervical cancer. C. It detects hormonal imbalances. D. It confirms menopause status. Answer: B. It checks for signs of cervical cancer. Rationale: pap smears are used to screen for cervical cancer. They do not detect ovarian cancer or hormonal status. Question 11. A nurse is preparing to administer misoprostol for cervical ripening. Which condition must be ruled out first? A. Urinary tract infection. B. Fetal macrosomia. C. Active vaginal bleeding. D. Previous cesarean section. Answer: D. Previous cesarean section. Rationale: misoprostol increases uterine tone and is contraindicated in patients with prior uterine surgery due to rupture risk. Question 12. A nurse is assessing a patient with endometriosis. Which symptoms should be expected? A. Vaginal itching. B. Mid-cycle bleeding. C. Cyclic pelvic pain. D. Painless heavy periods. Answer: C. Cyclic pelvic pain. Rationale: endometriosis typically causes pelvic pain that correlates with the menstrual cycle due to endometrial tissue growth outside the uterus. Question 13. A patient undergoing IVF asks about risks. Which response by the nurse is most accurate? A. There are no major risks. B. You may experience early menopause. C. Multiple pregnancies are more likely. D. It prevents all genetic disorders. Answer: C. Multiple pregnancies are more likely. Rationale: IVF increases the risk of multiple gestations. It does not eliminate all genetic risks or cause menopause. Question 14. A nurse receives report on 4 gynecology patients. Who should be assessed first? A. A patient with ovarian cyst awaiting surgery. B. A post-hysterectomy patient with leg swelling. C. A patient with fibroids receiving iron. D. A patient reporting menstrual cramps. Answer: B. A post-hysterectomy patient with leg swelling. Rationale: leg swelling post-op may indicate DVT, which requires immediate assessment. Others are stable. Question 15. A nurse is teaching a patient using a diaphragm for contraception. Which instruction is most important? A. Remove it right after intercourse. B. Use soap to clean it daily. C. Leave it in place at least 6 hours post-intercourse. D. Use it during menstruation. Answer: C. Leave it in place at least 6 hours post-intercourse. Rationale: the diaphragm must remain for at least 6 hours to be effective. Removal too early decreases protection. Question 16. Which patient behavior shows understanding of breast self-exam? A. Checks weekly at different times. B. Performs exam mid-cycle monthly. C. Inspects during menstruation. D. Examines monthly after period ends. Answer: D. Examines monthly after period ends. Rationale: best time is a few days after menstruation when breasts are least tender and hormonal changes are minimal. Question 17. A nurse is caring for a patient post-abortion with Rh-negative blood. What is the priority action? A. Administer iron supplements. B. Administer Rho-D, immune globulin. C. Begin oral contraceptives. D. Monitor for infection. Answer: B. Administer Rho-D, immune globulin. Rationale: to prevent Rh sensitization, Rh-negative patients must receive Rhogam after abortion or delivery. Question 18. A woman reports leaking urine during coughing and sneezing. Which condition is most likely? A. Endometriosis. B. Stress incontinence. C. PID. D. Fibroids. Answer: B. Stress incontinence. Rationale: this condition is triggered by increased intra-abdominal pressure, often seen in women post-childbirth. Question 19. A nurse teaches a patient using combined oral contraceptives. Which findings should be reported immediately? A. Nausea. B. Breast tenderness. C. Leg pain and swelling. D. Mild spotting. Answer: C. Leg pain and swelling. Rationale: these are signs of a possible DVT, a serious side effect of estrogen-containing contraceptives. Question 20. A nurse is educating a patient with HPV. Which statement by the patient requires correction? A. I need regular Pap tests. B. HPV can increase cervical cancer risk. C. I'm protected against all types with vaccine. D. Condoms reduce transmission risk. Answer: C. I'm protected against all types with vaccine. Rationale: the HPV vaccine does not protect against all strains. Continued screening is essential even if vaccinated. Question 21. A nurse is caring for a patient post-laparoscopic hysterectomy who reports shoulder pain. What is the nurse's best action? A. Administer prescribed opioid. B. Reassure the patient it is normal and offer ambulation. C. Apply heat to the abdomen. D. Notify the surgeon. Answer: B. Reassure the patient it is normal and offer ambulation. Rationale: shoulder pain after laparoscopy is common due to residual CO2. Encouraging ambulation helps reabsorb gas. Opioids are not necessary if pain is mild and expected. Heat may not relieve referred pain, and notifying the surgeon is not the priority. Question 22. A post-hysterectomy patient is confused and trying to get out of bed. What is the nurse's priority? A. Administer pain medication. B. Call the provider. C. Reorient and ensure safety. D. Apply wrist restraints. Answer: C. Reorient and ensure safety. Rationale: patient safety is the priority. Reorienting prevents falls and addresses confusion. Pain meds and provider contact may be necessary, but are not the first step. Restraints are a last resort. Question 23. A nurse is reviewing discharge teaching for a woman after a dilation and curettage DNC. Which statement needs correction? A. I may have light bleeding for a few days. B. I should avoid intercourse for at least 2 weeks. C. I can use tampons starting tomorrow. D. I'll watch for fever or foul discharge. Answer: C. I can use tampons starting tomorrow. Rationale: tampons should be avoided post-D, and C. to reduce infection risk. All other statements reflect appropriate post-procedure instructions. Question 24. A patient is admitted with suspected pelvic inflammatory disease, PID. Which assessment finding supports this diagnosis? A. Right lower quadrant pain with rebound tenderness. B. Severe flank pain radiating to groin. C. Bilateral lower abdominal pain and fever. D. Sharp pain with urination and suprapubic discomfort. Answer: C. Bilateral lower abdominal pain and fever. Rationale: PID typically presents with bilateral lower abdominal pain, fever, and cervical motion tenderness. RLQ pain may indicate appendicitis, and flank pain suggests renal issues. Question 25. During a Pap smear, the patient expresses fear about cervical cancer. What is the nurse's best response? A. You're probably fine. Most women don't have cancer. B. Let's finish the test first. We can talk later. C. It's normal to feel anxious. Do you have specific concerns? D. You should have come earlier to avoid the risk. Answer. C. It's normal to feel anxious. Do you have specific concerns? Rationale. Therapeutic communication involves acknowledging the patient's fears and offering emotional support. The other responses are dismissive or judgmental. Question 26. A nurse is caring for a patient with uterine fibroids scheduled for myomectomy. What lab value is most important to review preoperatively? A. White blood cell count. B. Hemoglobin and hematocrit. C. Platelet count. D. Fasting glucose. Answer. B. Hemoglobin and hematocrit. Rationale. Fibroids can cause heavy bleeding during surgery. Hemoglobin/HCT indicates risk of anemia or need for transfusion. Other labs are important, but not the priority here. Question 27. A woman presents with vaginal bleeding at 9 weeks gestation and no fetal heartbeat. What is the priority nursing action? A. Prepare for an ultrasound. B. Provide emotional support and privacy. C. Start for fluids. D. Notify the chaplain. Answer. B. Provide emotional support and privacy. Rationale. Emotional support is crucial during possible miscarriage. Ultrasound confirmation is needed, but not the first priority. For fluids and spiritual care may follow based on findings. Question 28. A nurse assesses a patient on hormone replacement therapy, HRT. Which finding requires immediate intervention? A. Mild breast tenderness. B. Spotting between periods. C. Calf swelling and pain. D. Weight gain of 3 pounds. Answer. C. Calf swelling and pain. Rationale. Calf pain/swelling may indicate a DVT, a serious risk with HRT. Spotting and mild side effects are common and not urgent. Question 29. A postmenopausal patient is prescribed calcium and vitamin D. What education is most essential? A. Take supplements on an empty stomach. B. Avoid dairy while taking calcium. C. Take vitamin D to help absorb calcium. D. Don't take calcium if you feel bloated. Answer. C. Take vitamin D to help absorb calcium. Rationale. Vitamin D improves calcium absorption, especially in postmenopausal women at risk for osteoporosis. The other options are incorrect. Question 30. A nurse receives 4 patients in the gynecology clinic. Who should be seen first? A. A 34-year-old with infertility concerns. B. A 22-year-old with severe pelvic pain and fever. C. A 48-year-old requesting pap smear. D. A 29-year-old needing birth control advice. Answer. B. A 22-year-old with severe pelvic pain and fever. Rationale. This patient may have PID or another acute infection. Prompt care prevents complications. The others are non-urgent concerns. Question 31. A nurse is reviewing the surgical consent for a patient undergoing tubal ligation. What statement indicates informed consent? A. I'll be asleep and won't feel anything. B. I signed this because my husband told me to. C. I understand this is a permanent form of birth control. D. I can change my mind during the surgery. Answer. C. I understand this is a permanent form of birth control. Rationale. Informed consent requires understanding of procedure, risks, and permanence. The other statements show lack of understanding or coercion. Question 32. A patient with endometriosis reports increased pain despite current medication. What should the nurse do first? A. Notify the healthcare provider. B. Offer a heating pad. C. Document the pain level. D. Assess the patient's current medication regimen. Answer. D. Assess the patient's current medication regimen. Rationale. Assessment is the first step in clinical judgment. The nurse needs to know what is being taken before taking action. Question 33. A nurse is educating a teen on the HPV vaccine. Which statement needs correction? A. It protects against some cervical cancers. B. You should get all doses for full protection. C. It can be given to boys too. D. Once you get the vaccine, you no longer need pap smears. Answer D. Once you get the vaccine, you no longer need pap smears. Rationale. Pap smears are still necessary because HPV vaccines don't protect against all strains. Question 34. A woman post-endometrial ablation reports foul-smelling discharge. What is the nurse's priority? A. Reassure her it's normal. B. Instruct her to wear pads only. C. Assess for signs of infection. D. Recommend OTC medications. Answer C. Assess for signs of infection. Rationale. Foul-smelling discharge can indicate infection. Prompt assessment is needed. Reassurance is inappropriate without ruling out complications. Question 35. A nurse is delegating tasks in a gynecology unit. Which task is appropriate for the UAP? A. Explain perineal care after D&C. B. Assist patient to the bathroom. C. Monitor bleeding post-hysterectomy. D. Teach signs of infection post-op. Answer B. Assist patient to the bathroom. Rationale. Assisting with ADLs is within UAP scope. Teaching and assessments require an RN. Question 36. A woman with a history of ectopic pregnancy presents with shoulder pain and dizziness. What is the nurse's first action? A. Start 4 fluids. B. Obtain a pregnancy test. C. Place the patient in high Fowler's. D. Notify the provider immediately. Answer D. Notify the provider immediately. Rationale. These are signs of possible ruptured ectopic pregnancy, an emergency. Provider must be notified to act quickly. Question 37. A nurse receives post-op instructions for a patient after vaginal hysterectomy. Which order should be questioned? A. Encourage early ambulation. B. Administer stool softeners. C. Insert Foley catheter daily. D. Monitor hemoglobin levels. Answer C. Insert Foley catheter daily. Rationale. Routine daily Foley insertion is not appropriate post-op. All other interventions are standard post-hysterectomy care. Question 38. A woman with PCOS is concerned about her irregular periods. What is the nurse's best response? A. That's just how your body works. B. PCOS often causes hormone imbalance. C. You must have thyroid disease. D. You'll probably go into menopause early. Answer B. PCOS often causes hormone imbalance. Rationale. PCOS is linked to hormonal imbalance, causing irregular periods. This response provides accurate education. Question 39. A patient is undergoing a colposcopy and appears anxious. What is the nurse's best intervention? A. Leave her alone for privacy. B. Tell her it will be quick. C. Explain what to expect during the procedure. D. Tell her to relax. Answer C. Explain what to expect during the procedure. Rationale. Providing information reduces anxiety. Privacy is important, but anxiety requires education and support. Question 40. A nurse is teaching a group of teens about safe sex. What topic is most important to include? A. Abstinence is the only way to prevent pregnancy. B. Only boys need condoms. C. Birth control pills prevent all STIs. D. Condoms reduce the risk of STIs and pregnancy. Answer D. Condoms reduce the risk of STIs and pregnancy. Rationale. Condoms are the only method that helps prevent both pregnancy and STIs. Teaching should be accurate and age-appropriate. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.